You're listening to the MotherToBaby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a MotherToBaby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the MotherToBaby podcast. My name is Chris Stallman, and I am a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I talk to people, so patients, family members, and healthcare providers, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication you're taking. It could be a cosmetic procedure that you have questions about, or it could be a medical condition. Today, I'm very happy to say that we are kicking off season 5 of the podcast. And to start things off, we are going to be talking about a medical condition called syphilis. Syphilis is an infection caused by bacteria. Most often, it spreads through sexual contact, and it's a serious condition that needs to be treated right away, because if not, it can cause major health problems. Our guest today is here to talk with us about syphilis in pregnancy. Robert McDonald, MD, MPH, is a medical epidemiologist in the Division of STD Prevention at the National Center for HIV, Hepatitis, STD and TB Prevention at the U.S. Centers for Disease Control and Prevention. Dr. McDonald serves as a CDC congenital syphilis subject matter expert, and he is also a practicing physician focusing on HIV, STI, which is sexually transmitted infection, and harm reduction care at a free clinic in Atlanta, Georgia. Dr. McDonald, welcome to the show.
Thank you so much for having me. Thank you so much for taking the time to talk about this important topic.
And quite timely, too. We're very excited to have you on because the CDC just published an update on the number of babies born in the United States with congenital syphilis. But before we go any further, can you tell us, what is congenital syphilis?
Yes, congenital syphilis happens when the bacteria or the infection that causes syphilis transmits to the baby during pregnancy. And treating syphilis before pregnancy or treating syphilis at least 30 days before birth can prevent congenital syphilis. There's reasons that we're so concerned about congenital syphilis. It's because there can be some devastating consequences and outcomes. And that can include miscarriages, stillbirths, infant deaths, and lifelong medical issues. Some of those medical issues can be blindness, deafness, trouble with intellectual development, or bone abnormalities, just to name a few things. But again, the important thing is congenital syphilis is preventable through timely testing and treatment during pregnancy.
Why is congenital syphilis on the rise right now?
Congenital syphilis is on the rise for a few reasons, but the biggest reason it's on the rise is because it's on the rise among women. We've seen an increase of a 10-fold increase in congenital syphilis over the past decade or the past 10 years. And that is because we've seen it going up among women. It makes sense that if syphilis goes up among women, we're going to see it going up among the babies as well. Additionally, we've seen a large lack of investment in public health infrastructure. Historically, that public health infrastructure has been what has been used to go out and to work with people who are pregnant and make sure that they're receiving the care that they need. If, for example, somebody has syphilis and they're pregnant, people from the healthcare workforce, the public health infrastructure, go out and make sure that those people receive the treatment that they need. When we lose those people, we lose the ability to make sure that everyone who has syphilis is adequately treated. We've also seen a rise of syphilis because of so many inequities that we see in the healthcare infrastructure. And many people really struggle to get the quality and the type of prenatal care that they need. And when we don't have proper prenatal care, we see devastating outcomes such as congenital syphilis.
So is syphilis not on the rise in men, or is it not captured in the same way? Because as you said, women are the ones who become pregnant. So are they the ones who are more often captured as having syphilis and being able to get treatment?
So prior to the rise among women, we were seeing syphilis among males or among men, but it was historically seen among men who have sex with men. Mm-hmm. And this was going back to about the end of the 1990s. That's when we started to see the rise in men in general. But around that time, around the 1990s, as a country, we had made a decision to really address syphilis. And a lot of investment went into making sure that syphilis was treated. And we saw syphilis really drop among all people. One of the downsides of this is that everyone thought that syphilis went away. So people stopped looking at syphilis and they stopped screening for syphilis. Mm-hmm. So first we saw it rise among the MSM communities, and then we started to see it rise among women. But with both communities, with everyone, really, we should be screening and testing for syphilis.
What are some ways that patients can reduce their risk of syphilis and then, of course, in pregnancy, congenital syphilis?
Yeah, the most important way that you can address this rise of syphilis is making sure that you ask your doctor about getting tested for syphilis. If you get tested for syphilis and you get the treatment for syphilis, and then if you're pregnant, your baby won't see the devastating consequences of syphilis. The good thing about it is that it can be treated and you can prevent so many of the outcomes. Additionally, when you're having a new sexual partner or with your regular sexual partner, be sure to ask them about syphilis or if they've been tested for syphilis or other STIs. As always, it's a good part of your conversation with your sexual partners to talk about the various risks that you may have or the ways that you can both together prevent STIs, and that is typically through getting tested for them and getting treated.
I think that's such a good reminder because, we go to people who are pregnant very often. We'll go to prenatal visits and there's a lot to think about. So it's a good reminder that we should be asking about, additional testing for things like syphilis. What about from the healthcare side? What can healthcare providers do to help educate patients and the public about reducing their risk for syphilis?
Yeah, I think, the first thing is what you're just mentioning. Providers need to talk to their patients about their sexual history. I think often it can be uncomfortable for providers or for some patients, but the more we talk about our sexual health with our providers, the better our chances are that we can talk about things that might be concerning to the provider or to the patient. And it's a way to make sure we're testing people for the right things. So in addition to taking that sexual history, they should be testing for syphilis. These recommendations that we just had with CDC, really we're saying that most of this country lives in an area that is at risk for syphilis acquisition. So that's over 70% of the U.S. lives in a county with a high rate of syphilis, and therefore, if you are sexually active, you should be getting screened for syphilis. So providers should be asking about sexual exposures, and providers should be testing for syphilis. Providers also need to work hard not to make assumptions about what risks the patient has. Mm-hmm. That's one of the reasons it's kind of a recommendation. Take that risk assessment out of the individual and look at a population base. For most people, their risk is not about individual actions. It's about living in a community with high rates of syphilis, and therefore they may be exposed to syphilis and need to be tested for it.
It's a great reminder, too. It's very easy for all of us as human beings, generally speaking, to make snap judgments about people. So I really appreciate the reminder of, if you don't think, that they would be at risk, that doesn't mean anything. You have to look at the data. You have to look at the information around you and that general screening. So that screening is for everybody. Is that correct? So during pregnancy, everybody, ideally, every woman who's pregnant should be screened for syphilis?
Yes. So everyone should be screened for syphilis at their first healthcare encounter when they're pregnant. So if you then or live in one of these areas of risk, you should be screened again at about 28 weeks of pregnancy. And then depending again on individual risk, you may need to be screened again at birth. So it's really essential to make sure that the screening happens. And if someone is pregnant and they are not receiving prenatal care, wherever else they come into contact with the healthcare infrastructure, if that's in an emergency department, if that's in a jail setting or written service program, those are also ideal situations where the person can be screened or tested for syphilis to make sure they get the treatment that's needed.
Thank you for including that, because of course there is a subset of the population that does not have access to prenatal care for one reason or the other. So I do appreciate that. And it sounds like the CDC has a lot of good information, not just on syphilis, but on congenital syphilis and ways to prevent.
Yes, definitely. So I think, our website has a lot of information about it, but it's also, again, so important to talk to your provider about, what are the best ways to prevent syphilis, to make sure you're getting tested for syphilis. And then again, if you do end up having syphilis, knowing that the quick treatment and the appropriate treatment is really important. The earlier we can treat somebody for syphilis, the better the outcome is in the pregnancy. Additionally, making sure that the partner is tested and treated as well.
Dr. McDonald, thank you so much for all of this information. Important all year round, but there is a special focus now that we're in January. It's Birth Defects Awareness Month and keeping these conversations going over time. So before we let you go, what is a final thought you would like to leave our audience with?
Yeah, I would say that over this past decade, we've seen such an incredible increase in congenital syphilis cases, to the point that last year we had over 3,700 cases of congenital syphilis and over 280 stillbirths and deaths. 9 out of 10 cases could have been prevented through appropriate testing and treatment. I think as a medical community, as a public health community, and as a community at large, we can and we should be doing better for pregnant people and for newborn babies. And this can be done through improving at the healthcare level the amount of testing and treatment that we have for syphilis. And then at the everyday level, talking about syphilis more, talking about STDs more and sexual health more, and making sure that we get the testing and the treatment that we need to make sure that we are as healthy as we can be and that our babies are as healthy as they can be.
Absolutely. Again, Dr. McDonald, thank you so much for your time today. We hope to have you back on a future show, but not only do we appreciate you, but also the excellent work and the attention to this really important topic. We really appreciate it.
Thank you so much, and thank you for talking about this important topic.
And that's going to do it for this episode of the MotherToBaby podcast. Be sure to hit that subscribe button so that way you never miss a new episode. And you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. And if you want to be on the podcast or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contact@mothertobaby.org. And MotherToBaby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847. By text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the MotherToBaby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Visit mothertobaby.org/donate today. Until next time, remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit mothertobaby.org.